Hi there, it's Dr. Julie with Summit Wellness Group, and today I wanted to talk to you about what to expect when you go on your GLP-1 shots, whether it's semaglutide or tirzepatide. These shots are both weekly, and you'll start at the lowest dose on either medicine. And we always start at the lowest dose because we want to make sure your body gets used to the medicines. And if you start higher, you could feel terrible and then you wouldn't want to be on it, and then it defeats the purpose. So we always start at the lowest dose. On average, people go up every 4 weeks. So you do 4 weeks at the lowest dose, 4 weeks at the next dose, 4 weeks on up. Sometimes if you're doing well, meaning no nausea, you're pooping well, you're feeling well, then you can move up maybe a week early. But in general, we like to move up every 4 weeks. Some people will start losing at one of the lower doses and they can continue on, and you don't have to move up until you're ready. Some people kind of hit a plateau and then they want to move up. And so you just have a little bit of wiggle room on when you move up. Some people do like to move up in between doses. The original dose pattern is based off the original studies, but we can move up slower if you need. And then, so the shot itself really doesn't hurt. They are the tiniest needles, and most of the time people can't even feel them. So I know a lot of you have fear of an injection, and that's okay. And we'd be glad to do your shots for you. If you live in Colorado, we definitely have a video. Hope you did a great video on how to give yourself your own shots. And most of the time when people start to get their shots on a regular basis and then try their shots, on their own, they realize that it's not so bad. So we believe in you and you can do this if you want. But we have some people that come to see us every week and have for a year. So it's really not so bad for the shot itself. When you get your shot, most of the time, if you get your shot in the morning, you might not even be hungry for dinner that night, which is really amazing. Sometimes it does take a week or two for some people to have a kick in, especially on the semaglutide at the lowest doses. But a lot of times people start feeling results right away. On average, people lose 1 to 2 pounds a week, which is 4 to 8 pounds a month. So it is slow and steady. Some weeks or some months you might lose more, some you might lose less. We definitely have weekly and monthly discussions on how your progress is and how you're feeling, and we have some tips and tricks on how to move through those those plateau times. Believe it or not, sometimes it's because you're not eating enough calories, which sounds totally weird and completely opposite of what we have always been taught growing up. But we need to make sure our body's getting enough food to function. And then again, we talked about side effects in one of the other videos. When people get the side effects, oftentimes they're the very first day when the body's getting something new, midweek as the medicine peaks, or at the dose changes. Again, the medicine does peak midweek, so you're going to feel the most appetite suppression midweek, and then you'll start to feel a little more hungry right before your next shot, which is super normal, like the night before and the morning of. Over time, those peaks and valleys even out, and then you'll have pretty steady appetite control. The really great thing about this medicine is that there's really nothing that's absolutely off limits. You can drink alcohol, but we definitely recommend cutting way back because one drink is going to feel like two because things empty out of your stomach slower. So just be very mindful of that. And the nice thing is that you get to eat real food and you get to participate in real life. And that's one of the compliments and comments that we've heard from people a lot, is that they don't feel deprived. They don't feel like they're dieting. They just feel like their body is, actually starting to crave healthier foods. You can eat at a dinner party. You can eat when you're on vacation. You can eat holiday meals. You just won't eat as much. So you don't feel like you're bound to preset points, meals, calories, anything. You're able to just kind of incorporate this into your lifestyle. And really that's one of the big things that we want to use this medication as a tool to help reset our minds, reset our habits. A lot of us have been eating the same way for 20, 30, 40, 50, 60, 70 years. And so we need to reset those habits, and it can take a while. But this really helps you do that. It really helps get that leptin and ghrelin in balance, helps with that dopamine system, helps calm those cravings, helps you feel less hungry, more satisfied. It really is a very normalizing feeling that a lot of us have never felt before. Again, I have been on this medicine for a year. I'm on a maintenance plan now. I've lost 50 pounds. Our nurse Hopi has lost 40 pounds. So we are speaking from the heart. We are speaking from not only practitioners, but as patients. And we believe that this is a wonderful tool that has been life-changing. And for those who need it, we want to help people get it. And we really want people to be proactive. We don't want people to wait until they're too sick before they, approach their doctor about it. So if you have questions, please let us know. We would love to talk with you more about it. Have a wonderful day. Dr. Julie with Summit Wellness Group, www.summitwellnessgroup.com. Have a great day.